Hi, welcome to COMD for 4710. This is lecture 3.A. Dr. Simon-Cereijido here. We started to talk about the fact that not all children have an easy time learning how to communicate and how to talk. Today we are going to learn about different risk factors for early communication disorders. A risk factor is any attribute or characteristic of an individual that increases the likelihood of developing a disease or an injury. Exposure to a toxic agent may also be a risk factor. We can classify risk factors in two main groups. Some risk factors are biological. For example, there are genetic disorders that put children at risk of developmental diseases or developmental delays. Exposure to teratogens during gestation may also result in developmental delays. Teratogens are agents or factors or chemicals that cause malformation of an embryo. These risk factors clearly affect the biology and physiology of a child, including the development and functioning of the nervous system. There are also environmental risk factors. These are external conditions or external exposures to the child that also influence the child development, in this case adversely. For example, a child whose family lives below the poverty line may not get adequate nutrition, health care, or education. Biological risk factors may play a role before, during, and after birth. Information about potential biological risk factors is often obtained during the parent questionnaire or parent interview and the review of the medical records. These are some biological risk factors that may affect a baby's development. We already talked about some teratogens, and remember that's a drug or other substance capable of interfering with the development of a fetus, causing birth defects. Now we're going to talk about age of the mother. Let's start with this. By the way, this graph shows how the average age of American mothers has increased throughout the years. A general principle of biological processes is that the extremes carry along more risks or are more atypical. So in this case, pregnancies in either very young or very old females are at increased risk of complications. Older mothers are more likely to develop medical disorders such as diabetes, high blood pressure, or other chronic diseases, which can affect the pregnancy and the birth, putting the child at risk of developmental delays. Older women have a higher chance of having a baby with a genetic abnormality such as Down syndrome, Edwards syndrome, or Patau syndrome. Down syndrome, also known as trisomy 21, is a chromosomal condition caused by the presence of all or part of an extra chromosome 21. It is named after John Langdon Down, the British physician who described the syndrome in 1866. Edwards syndrome, or trisomy 18, is a genetic disorder in which a person has a third copy of material from chromosome 18 instead of the usual 2 copies. Trisomy 18 is a relatively common syndrome. It is 3 times more common in girls than in boys, and the extra material interferes with normal development. Patau syndrome, or trisomy 13, is a genetic disorder in which a person has 3 copies of genetic material from chromosome 13 instead of the usual 2 copies. The extra material interferes also with normal development. To discuss a little bit more about risks and age of the mother, let's talk about Down syndrome. Down syndrome is the most common chromosomal birth defect. The risk of having a baby with Down syndrome is pretty low for young moms. So here you see this is a low risk. Only 1 mom out of 1,250 moms. But with age, the risk really increases. So an older mom will have she's more likely to have a child with Down syndrome. Now, teen pregnancy is also a risk factor. Teen pregnancy rates in the United States are substantially higher than those in other Western industrialized nations. So here you have the number for 2013. There were 26.5 births for every 1,000 teenage moms. Nearly 89% of those births occurred outside of marriage. The teen birth rate has been declining continuously over the past 10 years. The past 20 years. Still, the U.S. teen birth rate is higher than that of many other developed countries such as Canada and the United Kingdom. Teen birth rates differ substantially in age, racial, and different ethnic groups and different regions of the country. Although Latinas currently have the highest teen birth rates in the US, they have also had a dramatic recent decline in rates in the last years. Children born to adolescents face particular challenges. They are more likely to have poorer educational, behavioral, and health outcomes throughout their lives compared with children born to older moms. Another risk factor is poor maternal nutrition. Poor nutrition prior to or during pregnancy can result in developmental delays for the baby. A vitamin that is important for a healthy pregnancy is folic acid. Low levels of folic acid increase the risk of spina bifida, a birth defect in which the backbone and spinal canal do not close before birth. The vitamin folic acid, or folate, is important for brain and spinal cord development. It is estimated that the standard 400 milligrams dosage of folic acid that comes in most daily vitamins is capable of reducing the rates of spina bifida by 50%. It is important to know that the mother needs to take folic acid prior to pregnancy. So normally during the first months of the pregnancy, the 2 sides of the spine, here we have a normal one, or the backbone join together to cover the spinal cord, the spinal nerves, and the meninges here. That's the tissue covering the spinal cord. So let me get the meninges. So in spina bifida, what happens is that doesn't close. So there is extra spinal fluid coming out of the backbone, and that is associated to developmental delays. Okay, we are going to stop here for the first part, and I want you to write down your questions in your notebooks and also take notes, and we will keep on going in our next presentation. Thanks so much.